Do you have low back pain? Do you also notice that you have really tight hips? Maybe you notice that you get the low back pain anytime you need to use your hips, like during a golf swing. Or maybe you feel that back pain while you're doing something like a squat. Well, in today's video, we'll be going over a condition called hip-spine syndrome. Keep watching to learn more. What's up everyone, this is Dr. David Song at the Rehab Hero Clinic, and today we'll be talking about a condition called hip-spine syndrome. Now, this is one of the lesser common reasons of getting low back pain, and it is considered a diagnosis of exclusion. Now, what does that mean? A diagnosis of exclusion is a diagnosis that you only consider once your major orthopedic conditions are ruled out. Now, this includes stuff like sciatica or the causes of sciatica, including lumbar disc herniations, sacroiliac joint syndrome, lumbar facet syndrome, etc., etc. A diagnosis of exclusion is a diagnosis that will appear negative or normal on things like x-rays, MRIs, ultrasound imaging. All those things will not show what is wrong with your back. Now, this can be really confusing, especially if you've been experiencing low back pain, because a lot of the time you think, I have pain in this area, there must be something wrong with this area. However, with hip-spine syndrome, there's actually nothing really wrong with yourself from an anatomical or a structural standpoint. This is more of a functional diagnosis. It's a condition that is affecting you based on how well your body moves in terms of movement quality. Now, when we're talking about hip-spine syndrome, it isn't really well documented in the research. I'm gonna be straight up with you on that. However, in the research, some things that they do take a look at is the association of low back pain and lack of hip mobility. Specifically speaking, is hip internal rotation. So those who have been diagnosed with hip-spine syndrome, it usually is low back pain secondary to lack of hip mobility, specifically internal rotation. Now, how much hip internal rotation do you need? You need roughly 45 degrees of hip internal rotation. If you have less than 45 degrees of hip internal rotation, at least 3-month history of low back pain, and you find that your low back pain tends to be associated with movement. Now, that could be while walking, that could be while you're at the gym, it could be while you're playing something like golf. If you notice that that's what causes the flare-up of your low back pain, this is something that you might want to consider. Now, like I said, this is a condition that is a diagnosis of exclusion, which means you want to get those other conditions ruled out by your healthcare team. That includes your physiotherapist, your chiropractor, or your sports medicine doctor. You want to make sure that all that stuff is good. If you do have underlying issues from a structural standpoint, anatomical standpoint, you want to make sure those things are treated first. And if you still have associated findings of low back pain, even though all that stuff is all good, then that's something that you might want to consider from a functional standpoint later on in your rehab journey. So why is it that your low back pain is happening due to a lack of hip internal rotation? Now, this is something that you need to start thinking about. And basically, this is how the theory goes. If your hip is lacking hip internal rotation and you do a movement that really demands a lot of hip internal rotation, or at least more than what you actually have, that movement has to come from another part of your body. Now, usually when you need to accomplish a task or a movement that exceeds your body's capabilities of achieving so, the compensation usually happens at the joint adjacent from the one that's being hypomobile. So in this case, if the hip is not really moving that well, then sometimes your knee will have to compensate, or in this case, in hip-spine syndrome, it's your low back or SI joint that has to compensate for that lack of movement. This is a lot easier to visualize when you actually start thinking about it. So if I have no hip internal rotation and I need to do a movement that requires it, how am I still going to achieve my movement? Is I'm just going to rotate through the spine, right? So when you actually think about it, you're now putting excessive stresses through the low back, through your SI joint that would normally not be there if you could just use your hip properly. And now it causes fatigue overload of the structures of your low back, leading to soreness and pain. If you really think about it, the low back is a victim in this scenario and the hip is the culprit. That's a root problem that we're looking to address today. So in order for us to do that, we do have to work on your flexibility program first, and then we'll be moving on to your mobility and then strengthening program after. So today we're going to get started on knowing how to self-check whether or not you have enough hip internal rotation. There's a very easy test that you can do, and we'll do that right now. All right, so for the self-assessment to see if you have enough hip mobility and internal rotation, you're going to use something like a foam roller or a yoga block. You could use, if you don't have these, you could also use a towel that you roll up and you're just going to place it in between your knee. I'm going to use a foam roller because it's a little bit easier to visualize what we're trying to achieve. The first thing you're going to do is just put this foam roller between both of your knees. This is going to be your neutral position. So this is 0 degrees of internal rotation. From here, we're going to see how much internal rotation you have by keeping the knee pinned up against this foam roller and then raising your foot so that it moves away from the foam roller. So right now I'm going to take a look on my right side here and I'm going to see how much internal rotation I actively have. So as you can see, what you're looking to get is anywhere between 40 to 45 degrees of hip internal rotation. And it's really important that while you're doing this and we take a look at that angle is measured between the foam roller and the angle of my shin. While I'm doing that, how does that feel on my body? Do I feel any cramping in my hip here, in my gluteus medius and minimus muscles, even my TFL? These are your 3 muscles that are going to be responsible for hip internal rotation. And am I able to hold it with low, medium, or high effort? If this is something that's very difficult to do, we'll talk about that in a second. The last thing you want to think about is, can you even reach full range of motion? So sometimes you might be stuck here. You might notice you only get somewhere between 15 to 20 degrees of hip internal rotation. That is a clear sign that we have some work to do. Now that we've identified that you do or do not have hip internal rotation limitations, we're going to go over a progressive series of exercises that you'll be doing. It can take a course of weeks to months in order for you to go through all the different stages of recovery and increasing your active, passive, and resistant range of motion. If you notice that you're unable to reach full range and you could go only halfway or partially there are a few reasons why this might be happening. One of the most common reasons is that you simply lack flexibility, and this is what we call passive range of motion in the healthcare world. Passive range of motion is how much range of motion you simply have within a joint. Limitations can often be caused by tightness in either your joint capsule or the antagonist muscle group, namely your external rotators. So if your external rotators, that is your gluteus max, posterior fibers of gluteus medius, if those are your limiting factors, they can stop you from moving into hip internal rotation sufficiently. Well, enough of that. We'll go over some of the flexibility exercises that you can get started on from the comfort of your own home. So let's get started. All right, for your first flexibility exercise that we'll be doing to improve hip internal rotation, we're going to use something like a dowel to help us go into internal rotation. When you're lacking passive range of motion, usually you need something that's going to assist you to push you into a deeper range of motion so that you could stretch out that hip and joint capsule. So in this case, we're going to be using a dowel. If you don't have a dowel, any broomstick will work, or any stick period will work. So if you have a hockey stick, a golf stick, or a golf club, I should say, anything like that will help you to reach deeper levels of hip internal rotation. So from here, what we're going to do is we're going to grab one end of the stick and we're going to feed it behind our knee from the outside, and it's going to hook onto the inner aspect of our ankle. From there, we're going to make sure our hip is starting in neutral position, keeping this hook right there. I'm going to just take the stick and I'm going to pull it into my midline. By doing so, I'll be pushing my foot outwards from my body and pushing my hip into internal rotation. So when you're trying to improve your hip internal rotation flexibility, it's really important that you consider the dosage that you're doing it at. So most people do not hold a stretch long enough. If you're looking to improve your flexibility, you're going to have to hold a pretty long stretch. So here, I am looking to hold a stretch for about a 2-minute period, and the stretch is going to be done at a 2 to 4 out of 10 intensity. So I'm not looking to push my hip into a super deep stretch right away. I'm really looking to see how much I could push my hip into internal rotation while still being as relaxed as possible. If you're finding that pushing your hip into internal rotation is causing your butt to lift off your seat, or if you're finding that it's causing some of that pinching, back pain that you've been getting because you have hip spine syndrome, then all you gotta do is back off by just easing off that stretch a little bit. It's really important that while you're holding the stretch, that you're able to take nice, relaxing, deep breaths, because relaxation is key when it comes to improving your hip internal rotation flexibility. Now, this goes with all the flexibility exercises that I'll be showing you today, but flexibility exercises need to be done every single day. The research shows that if you don't do the stretch every day, you're really not going to be getting the results that you are looking for. So in this case, if you're looking to improve this hip internal rotation. When it comes to doing your stretches, I usually tell my patients the more the merrier. You could do about 2 to 3 repetitions a day, each one held for about 2 minutes, and making sure that you're doing at least 2 minutes of rest between each repetition. So we're looking at a 1-to-1 work to rest ratio. Now, if you do not have an exercise dowel like I do, I'm going to show you an alternative exercise that you can do to improve your hip internal rotation. That exercise will be the 90-90 internal rotation stretch. All right, so for this next exercise that we'll be doing, this exercise is called the 90-90 hip internal rotation stretch. You would want to make sure you have a padded surface like a yoga mat, an exercise mat, or at least on carpet if you're doing this at home. To get started, all we're going to do is place our hands behind us, and we're going to sit in this bear stretch position where your heels are on the floor about shoulder distance apart. And I'll be targeting my right hip here for the purpose of this exercise video. So from here, all I'm going to do is, while I'm keeping my hands behind me to support myself, I'm going to rotate my knees towards the ground and into internal rotation. So while I'm doing this, I'm making sure that I'm kind of creating these 90-degree angles in my knee, in my hip, and into my other knee. So for this exercise, you may feel it in your gluteus maximus muscle, your gluteus medius muscle, or sometimes you'll feel it really deep down inside your joint. This is because it'll be actually targeting your hip joint capsule. Now, where you feel it would just really depend on where your specific limitations are. So where you feel it versus someone else, it might be a little bit different. For this exercise, your goal is to get this knee towards the floor all the way until you can actually tap it down. So for some people, that might mean, especially if you're limited in hip internal rotation, you might have to cheat a little bit by just taking your back hand on the right side if you're targeting the right hip, and then moving it towards the left leg. This will allow that knee to go down to the floor so you can get into this rested position, and from there you can adjust accordingly. And you'll do so by then slowly, while maintaining contact with the floor, then rotating back out to that original position and going only as far as you can without letting that knee come off the floor. If you find some tension building up on the inside of your knee, that can be because some of your hip adductor muscles are a little tight. So in that case, you can either bend the knee a little bit more and that should alleviate some of that pressure, or you can straighten it out. Some cases you could just plantar flex your foot or dorsiflex the foot. Just changing the angle of your knee or your ankle can help with alleviating some of that pressure. And again, just back off. The goal isn't to stretch out the structures near the knees. Find that putting yourself in a certain position causes a deep stretch in the knee, just back off a little bit. From here, just like we did with the dowel and hip internal rotation exercise, we're going to be holding the stretch for about 2 minutes. If you find that you can actually get the knee to touch the floor and you can rotate pretty far along, the second goal will be to get this bum to touch the floor as much as possible. So right now, most of my weight is on my left hand, but as I progress and become more flexible, I'm going to shift my weight onto my right side just so I can push myself into a little bit more of that hip internal rotation, using my body weight to assist me into this movement. Just like the last movement that we did, we're going to be doing this exercise every single day, and it could take about 1 to 2 weeks for you to get to your full range. In some cases, people may take longer. I've seen some patients take about a month to a month and a half before they can reach full range of motion. It really just depends how much range of motion you have to begin with, and some other factors like how old you are and if there are any other underlying conditions that could affect your hip mobility, like hip impingement or arthritis. Now that we've held this exercise for about 2 minutes, you're just going back off by rotating it back up to a neutral position. Rest for 2 minutes. You could of course just do the other side. Since you have to rest your right side, you could just start stretching your left side if you need to work on both of your hips. And you do it for 2 minutes. Right after I'm done this, I could just alternate sides once again to target my right hip. Those are the 2 exercises you can do to improve your hip internal rotation flexibility. You can do both if you want to do, you don't need to. I usually find that patients respond to one of these or the other, but of course, like I said, when it comes to flexibility training, the more the merrier, so long as you're not pushing through pain and it's not causing aggravation of your symptoms. So it's really important that while you're doing these stretches, that it's comfortable on your low back, it's comfortable on your hip. Mobility exercises are there to help you improve your active range of motion. This is how much range of motion of your passive range of motion you can actually control. Just because you opened it up passively does not mean that you all of a sudden have full control over your range of motion. So mobility, if you ask me, is actually more important than flexibility, but cannot be worked on until flexibility is fully established. So flexibility is about opening that range, mobility is about controlling that range. So we're going to go over exercises that aim to get you to improve how much of that range you can actually control. So I like to do this next exercise in a doorway just because it makes it a lot more comfortable for you to use. In this exercise, I'm going to be standing in the actual doorway itself, and I'm going to be raising the leg I'm targeting to about hip level. So I'm raising my knee to about hip height, and I'm going to plant the inside of my knee right up against this wall. From here, I'm going to go like that, okay? So this is our starting position because we're trying to change our hip internal rotation from the way we tested it, which is hip flexion. So for this exercise, the goal is to keep the knee pinned up against this wall. And while you're keeping it pinned and you can hold onto the door frame as needed for balance, you're just going to rotate your hip into internal rotation to try to get your heel to move as far away from this wall as possible. So just to show you what that looks like, I'm gonna go rotate out, and I'm going to bring it to my end range, which should be full. I should be able to hit full range. And I'm going to hold that with max effort for about 5 seconds, and then I'm going to rest for about 5 seconds. And as you can tell from my labored breathing, this was my max effort. I put in everything I got into this exercise, and that's what you're going to need to do to improve your end range strength, AKA your mobility. Usually I like to get my patients to do about 5 repetitions. We're going to go for a second one right here, keeping my knee pinned up against the wall. Rotate, 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 rotate. Hold as hard as you can, make sure you're breathing. And I'm going to come back in and rest for another 5 seconds. I'm going to do another 3 repetitions here. Rotate out, and hold. And coming back in, going for 2 more. Now, when you're doing this exercise, you can rest for your leg completely for those 5 seconds, just so your hip flexors don't get too tired. Pulling it back up, rotating out, hold, 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 hold. Coming back in like that. I'm gonna go for my last repetition here, and then I'm gonna give you a few more tips while you're doing this exercise. Now, it's really important that while you're doing this, you're not hiking your hip to try to cheat your way to hip internal rotation. With hip spine syndrome, the tendency is that if you do not have hip internal rotation, people tend to hike their hip, which causes jamming of your lumbar facet joints. It could cause jamming of the sacroiliac joint, therefore causing sensitivity and pain, soreness, etc. So it's really important that while we're doing this, my hip here, the bottom of my hip, or where my ischial tuberosity is, I'm trying to push that towards the ground while I'm also trying to rotate my foot away. So you kind of try and do 2 things at once. We're trying to isolate the hip internal rotation away from any pelvic movement, any lumbar movement. So going here for our last one, raising my knee to roughly hip height, I'm gonna rotate, and you should see that my pelvis doesn't hike up like this. It stays nice and low, rotating that foot away, holding that for 5 seconds, and coming back in, and I'm resting. Now, when you're doing this exercise, you'll be doing anywhere between 2 to 3 sets. And our mobility program is actually going to change from our flexibility program. And that's because when you're doing flexibility training, all that training is done passively, which means that you're using external forces like the stick, like gravity, to push you into your range of motion. You're really not engaging your muscles. But when we're doing mobility training, you're engaging your muscles and you're engaging them hard. As a result, muscles need to recover from these exercises. And since we're putting our high effort into this, we want to make sure we're giving our muscles adequate rest. Usually muscles require 4 to 8 hours of recovery in order for them to fully recover from the exercise that you're doing. And again, we're doing 2 to 3 sets. If you're resting your hip for 48 hours after doing this exercise, we're really looking at doing this exercise about 2 to 3 times a week. If you're able to stay consistent, you should notice that your hip mobility will start to improve in both range and how much effort it takes you to reach your full range. Now, your end ranges are always going to be difficult because it is your end range. It's kind of like trying to do a bicep curl as hard as you can from the bottom position, right? It's just the hardest position to kind of activate your muscles in. So it'll always be hard to do. But so long as we can get to your full range, you've achieved the task that we're looking to get, which is get to that 45 degrees of hip internal rotation actively, and that's part of our mobility program. Now that we've finished that exercise, we're going to be moving on towards our second mobility exercise, which is a modification of the 90-90 hip internal rotation stretch that we did during our flexibility phase of training. Now that said, all those exercises that we did during our flexibility training, you can continue doing those during the mobility phase of your rehab journey. It's just that you don't need to do it at this point. You'll likely maintain the flexibility that you gained due to the mobility training that we're working on. All right, so now we're back on our yoga mat, exercise mat, or carpeted surface, and we're going to go back into that 90-90 stretch. Now we're going to modify a little bit, and I'll show you how. So starting off with that 90-90, at this point, if your flexibility training has been completed, when you're going into this 90-90, you should get to this end range position pretty easily without having to rotate the body. That said, we are going to move our body a little bit so that we can put some slack into our hip here. So in this position, it should be a lot easier to hold. But what we're going to do is train our end range strength abilities. I'm going to keep my knee pinned to the ground right now, and I'm going to attempt to raise my whole entire shin off of the floor so that I'm actually activating my hip to go into my end range hip internal rotation. I'm going to put both my hands, one hand in between both my legs, the other hand just behind me, keeping my knee pinned. I'm going to raise my leg as much as I can off the floor and hold that for 5 seconds and then drop it back down. Now, as you saw in this video, I barely raised that leg off the floor, and that's something that you should expect in this exercise because we're only giving ourselves about 5 to 10 degrees of space or 5 to 10 degrees of movement to raise our leg through as we're trying to really work on our end ranges at this point. I'll go for another round here and get one hand planted in between my legs, my other hand behind me, or I should say to the side of me, keeping my knee pinned to the floor. I'm going to raise my whole entire shin, ankle, foot off of the ground for 5 seconds. Make sure you take a nice deep breath and exhale as you raise. 1, 2, 3, 4, 5, and I'm going to rest for another 5 seconds. Just like our last exercise that we did in the doorway, we're going to do 1-to-1 work to rest ratio, 5 seconds on, 5 seconds off. I'm going to go for my next rep right now, and go. And rest, and I'm going to be doing about 5 repetitions, so 5, 5, 5. That's how much you're going to do. You're going to be doing, again, just like the exercise, 2 to 3 sets, 2 to 3 times a week. That's the dosage we're looking for during your hip mobility program. Up next, we're going to be doing another exercise called the tactical frog. And for this exercise, it's really important that you're going to use a matted surface just because it puts a little bit more pressure on the knees, which might hurt if you're just doing it on a hardwood floor. Sometimes I might even get my patients to double stack the yoga mat just by folding it in half. And this is what it looks like. So basically, I'm going to now get my yoga mat, rotate it, just so I can show you what it looks like. And I'm going to be doing an exercise called the tactical frog. So for this exercise, I'm going to come down to the floor. I'm going to, again, get my knees about shoulder distance apart, elbows down to the ground, kind of in this quadruped position. I'm gonna get my foot and rotate it away from the ground. So here I'm starting an external rotation a little bit, and I'm gonna be rotating my hip by raising that foot off the ground and trying to get that foot and ankle to move as far away from my midline as possible, squeezing that end range here for 5 seconds, and then coming back down to rest 5 seconds. Now, in this exercise, there's a pretty high tendency for people to cheat by, again, twisting through the lumbar spine, twisting through the pelvis, side crunching the lumbar spine. So I actually like to have my patients to do both sides at the same time. By doing both at the same time, I get both my hips moving into internal rotation, and because the demand is going to be equal on both sides, I won't be able to rotate or twist my lumbar spine in one way or the other because it needs equal amounts on both sides. So this is a really great way by doing this exercise on both sides at the same time to prevent yourself from cheating, holding that end range 5 seconds and coming back down. Now, when it comes to doing these hip mobility exercises, because we are contracting our muscles in the most shortened position possible, it is not too uncommon to feel cramping in these muscles the first few times you try these exercises. Now, cramping is not a bad thing. That cramping is actually just a sign that these muscles are deconditioned. They just do not know how to contract through this shortened range of motion because you just never trained it before. I usually tell my patients, if you feel some cramping, just back off a little bit, rest, and try it again. If you can't get rid of that cramping, just go all in on that. As long as it doesn't spaz out of control, your cramping sensation will slowly go away, even within the same session, because your hip muscles are learning how to control your hip for the first time ever. Now that we've done our 3 mobility exercises, you'll do all 3 of these back to back with about 1 to 2 minute rest between sets. But you're going to be doing all these exercises on the same day, rest the day after, and try it again 2 days after in total. So say it's Monday, do my program, Tuesday I rest, Wednesday I'm going to try this series of exercises again. Up next, once you have that full active range of motion, we'll be going over how to start doing some resisted exercises for your hip internal rotators. Now that we're moving on to our resistance training / strength training program, we're going to be throwing in some resistance bands into the mix. These are loop bands. You're going to need them for this exercise that we're doing. I'm going to be using a yoga block as well. And again, if you don't have a yoga block, you can use a foam roller or a rolled up towel. So to start, I'm going to get this band and I'm going to loop it around both of my feet. You can also loop it around your ankles, but I prefer the feet, as research has shown that whenever you're doing banded work, having the band around your foot activates your glutes a little bit more, and that's exactly what we're working. We're going to work some of your glute muscles that are responsible for hip internal rotation. Next, I'm going to put this yoga block right between my knees, and I'm using this just to pin my knees together. I'm going to hold it with my hands, and I'm going to just take my right leg, that's the one I'm targeting for this video, and I'm going to do some hip internal rotations against the band's resistance. Now, I'm using a very light band, but because this is a movement that most people don't train, myself included, this is actually really difficult to do. And we're going to do repetitions this time, so we're not really aiming to do long duration holds like we had to do for our stretches and for our mobility exercises. Instead, we're just going to do a 2-second tempo gain out to the end range, so a 1 Mississippi, 2 Mississippi, then we're going to come in at a 1 Mississippi, 2 Mississippi. And we're going to go for repetitions now. So before we only went for 2 to 3 reps of the stretch, 5 reps of the mobility exercises. And for these strengthening exercises, we're going to be aiming anywhere between 10 to 15 repetitions as you're doing this exercise. It's really important, again, that we're not trying to cheat with our hip. Just because we have our full range of motion, it doesn't mean that we really broke that habit of cheating. You've been doing it for so long, it's going to be a hard habit to break. So really be strict on how while you're doing your form. I like to keep my hand on my pelvis, and I'm doing this to see if I feel that hip move up into my hand. If I'm doing this internal rotation and I feel my hip move up, I just use my hand as a self cue to kind of push my pelvis back down, just so I know that I'm not cheating. Some other tendencies is to just kind of side crunch, and so for this exercise, it's really recommended that you try to sit up as tall as a tree while you're doing it, just so that you know that this movement is being isolated at the structures of the hip, and you're not just trying to do a side crunch, right? That movement or that mechanism of movement is kind of what got you here in the first place. And we want to make sure that habitually we're not just doing the same thing, even though our hip has all the range of motion, all the strength, we're also breaking the habit of relying on our lumbar spine to move instead of our hip. We're going to do about 2 to 3 sets of this exercise, making sure that you rest for at least 1 to 2 minutes between sets. For your strengthening program, it's going to be similar to your mobility exercises in that you're going to be doing it about 2 to 3 times a week with about 48 hours of rest in between each exercise session. All right, for our last exercise of today's video, we're going to be doing an exercise that needs some weight resistance. I like to use a weight plate. You could get one of these, or you could find these at the gym, but really you could use any weight that would slide around the floor. So I like to use a weight plate, but you could use any non-rubberized kettlebells or dumbbells as well. I'm going to set up, I have a pad here for my knee, so you can set up with an extra thick yoga mat or exercise mat. And I'm going to be starting off in this kind of half kneel position where I am kneeling with one knee and the other leg is in front of me. This leg doesn't really matter. Like if I need to position it for better balance, I'm going to. And then I'm going to put this and use my weight plate almost like a disc. From here, I'm going to put my forefoot onto it, and all I'm going to do is keep my knee pinned to the ground here, and I'm going to rotate my thigh into internal rotation just by rotating it like that. And because I am moving the weight, this is done through resistance, and then I'm going to come back in just like that. So once again, I'm pushing the weight away by sliding it against the floor, and then I'm coming back in. Just like the last exercise that we did, we're going to be 2-second repetition. So I'm going to 2 seconds out, 1, 2 seconds back in, and I'm going to be doing anywhere between 10 to 15 reps of this exercise. If you want to increase the difficulty, instead of putting my foot on the weight plate, I'm going to put my foot on the floor, and I need to push the weight plate away from me. So I'm going to push it out all the way, and then I'm just going to pull it back in. And then I'm going to push it away from me, just so that I'm moving it away, and I'm trying to go for that 45 degrees internal rotation, and then I'm gonna pull it back in. If you don't have something like a weight plate, you can always loop a band around the foot and then anchor it down somewhere beside you so that you're just rotating that leg against the resistance of the band. For the resistance or strength training program, it is really important that we are using resistance, because that's the only way we're going to get our hips stronger is by introducing an external load, an external weight resistance for us to work again. That sums up all the exercises that we'll be doing to improve your hip flexibility, your hip mobility, your hip strength. And we're doing this because we're trying to restore full hip function so that your low back and your sacroiliac joint will stop compensating for the lack of movement in your hip. Please remember that it's always recommended to see your physiotherapist or chiropractor or healthcare team before you try any new exercises for pain. And this is because you want to make sure you're on the right track with which exercises that you're supposed to do. That includes the exercises in today's video. Make sure that you are asking your healthcare team about them to see if they are right for you. If you're in the Greater Toronto area and you're looking to book an appointment, you could come to one of our Rehab Hero clinics. We are located in North York and Markham. You can find the link to that in the caption below. If you have any questions about the exercises in this video, please let me know in the comments below. I'll answer you as soon as possible. If you're new to my channel, please hit subscribe, like the video, and I'll see y'all next time. Peace.